So I think what I'm presenting here is one of the challenges in the work that we do, which I think both patients and surgeons often quite underestimate, and I call this the high and the blues in the body contouring experience. And I tell you, this is something that both as a patient and surgeons are practicing, and that it will amaze you how significant this is. And just for background purposes, breaking that down, we are running in our sort of very intensive practice on based on body contouring, and most really centered around 360-degree liposculpting, and very important fat grafting shaping on the buttocks, which I would classify probably as the most powerful procedure in the whole spectrum of plastic surgery. And I think if you do this, you get a taste of what this can do. It's in the good way, it's an extremely, what I call a high-performance procedure, and feedback that you get from patient is incomparable to any other procedures. You get, I mean, easily feminization of waist to hip ratio, as we call, by 20% per round of fat grafting, sometimes more, sometimes less. It always depends on anatomical preconditions, but that, you know, like in a tight dress for patients, it makes a massive difference. I can assure you about that. You get a kind of synergistic effect between lipo filling and fat extraction. You get also a reasonable improvement of projection index. I'm always amazed, you know, how strong this effect can be of patient self-perception, and generally you have an extremely high satisfaction rate. But there comes a small point to that, because one thing about this operation is a bit tricky, and this is what I'm centering this presentation on today. To get a taste of it, we always call this the same outfit challenge, which is a beautiful thing, you know, to assure your patient satisfaction. Do a photo in the same or similar jeans or just before, and you'll be amazed. I mean, that is really very rewarding for both parties. But so what is the issue? The issue in these procedures is that, in contrast to many other plastic surgical procedures, the look directly after the surgery is often much more dramatic than the final result. And I can tell you, most patients actually love it. And what you have on top of this is what I call the social media escalation. I think nobody loves, you know, exposing the work more on social media more than I do, but I always point out that's a bit like your friend and your foe at the same time. I'm going to tell you why that is now. Now, translating it for the male spouses of my patients, and they usually understand me best, as what we call BBL surgery or mega fat grafting to the buttocks, is like getting a Porsche Turbo and test driving a Ferrari, if that makes sense. So the effect that I try to make patients aware of before, thankfully often with success, sometimes without, is we want to avoid that you get the Porsche Turbo and then you are, let's say, moderately satisfied with the Porsche that you actually set out to have, because now you're in love with a Ferrari, which is the overblown look after the surgery. And this is what I think currently, you know, I always say in our group here is let's say the last 10 years we've learned to manage patients' bodies. Now we learn to manage patients' minds. Because it's not easy to prepare patients for that. Easy because the blow when you see that in the mirror the first day is extremely strong. And I always try to keep understanding 50%, there's not only fat resorption, it's fat and water resorption. 50% of the volume you see in the mirror gets lost. So don't underestimate how high the psychological impact of seeing that in the mirror the first day is. And this goes down significantly the first 2 weeks. And I think this is, for my humble view, really the reason, or at least patients tell me, so why they do, so many of them do round 2, because they say, look, I won't buy what I saw in the mirror the first day. And it's a part of this transformation experience here, which most patients cope with very well. Some don't, but most do. Yeah. Now, yeah, let's go into a case that I actually have to say, I love this patient. I mean, she's gorgeous, yeah, and actually because she approached this with a bit of a self-irony, and so here you see the before and you see the after. And I think every reasonable-minded individual will agree with me that it is a fantastic outcome. I'll show you pictures of what she looks like in a dress now, and you'll be amazed. But now you see, this is before, and this is, I think, about 2 months after the surgery. This is 2 weeks after the surgery. So I see now, this is a beautiful case to demonstrate, where we're coming from. It's a great before and after pic, but after 2 weeks, it looks even more drastic. And actually, when she sent us this picture, I said, I'm so thankful. It makes me really happy to get this kind of pictures, but be careful, it's not the final result. She said, no, I know that, but I just want to enjoy it. So, and I think it's a good demo case, to demonstrate, why so many patients get a little bit addicted into it again. And this is the same patient in the dress, and I think these pictures speak for themselves. Yeah, so when you do that, and now I'm directing this to the surgeons that we encourage to get their hands on this. Say, don't be surprised if you have a patient with this situation. And I said, well, you're right, I liked it more 2 weeks after. Don't be surprised, it's just part of that. Where I'm also, with all the joy that we have with this procedure, I add a word of caution. And I think this is really a phenomenon of the social media generation. I think this is going to be a big challenge, for us or the guys who come after me in the next decade, which are called the wanderers, or sometimes some call it the surgical sister community. And I see this with some concern, because I see, in recent time, a real high potential for complete escalation of expectations. We like high expectations, but they should always be kept somewhere within the reality of each individual patient. Wanderers never question their expectations. They only question the surgeon. They go from one clinic to the other. They kind of never find happiness. They have absolutely neither. I'm not sure if it's ability or willingness to accept the limits of the individual body potential. And I think often I get the impression they don't really want to be a better version of themselves. They just want to be somebody else, and that can be very, very challenging, to measure. And I think it's very challenging to identify potential wanderers in the pre-op phase. It's a great quote, I think, which really hits the truth of our work on the spot. Is you can't please a patient who thinks you're a carpenter carving a piece of wood, and this is what we've cleared out before. But overall, as I say, maintain a certain awareness of that. I'm trying, really, I think it's a great part, an important part of BBL surgery, to try to prepare patients for that blow, which many really enjoy. And it's still, as I say, it's a very powerful surgery. Just bear that in mind. And I think this is going to be a challenge, With this surgery evolving and getting more and more popular, we will have to live up to that. So in our next Congress, which I'm inviting the surgical audience for June, which we hope will already be something like a post-COVID area, hopefully, we will really make a big focus. We'll have a panel about these things, that like managing your practice in the social media area, and moving on from not only managing patients' bodies, also to managing patients' minds. So stay curious. This is a great topic and a great challenge for our work in the next years to come.